Welcome, everybody, to another episode of Revive Your Health Podcast. I'm your host, Dr. Brandon Schreiner. Today, we're talking about restoring the body's God-designed healing power through chiropractic care. I've been a chiropractor for over 15 years. Real quick, I was an elite-level wrestler, elite-level CrossFit athlete. Chiropractic was not something that I was really a big fan of. Always pretty healthy. My parents did not take me to a chiropractor when I was a kid or when I was born. I got the pink bubblegum, antibiotics for ear infections, got tubes put in my ears. Pretty typical life growing up. When I had a symptom or a sniffle or a sneeze or a fever, we didn't say, hey, this is a natural response of the body. Let's go to a chiropractor. Let's get adjusted so that way the body can heal. And so I can relate to a lot of you that this may seem kind of like a foreign thing. But today we're going to break down why chiropractic, why the 5 essentials of health that we talk about in our office is one of the most effective systems to keeping somebody healthy, vibrant, and drug-free. Really, the theme of today is really health isn't something that we chase with pills and procedures. My story, I was wrestling for the Ohio Bobcats back in 2002. In 2005, I woke up and I couldn't feel my fingers. Ended up having a career-ending neck surgery. They took a plate and bolted my spine together. And when that happened, my symptoms got better. But then later on down the road, because the cause or the root cause of the problem wasn't correct, that I started having debilitating migraines. And I ended up having tingling going down the other side of my arms. And if it wasn't for a chiropractor teaching me about the principle of health, like where health comes from, above, down, inside out, God does not create junk type of a healing process, I wouldn't be where I am today. 6 months after chiropractic care, all my symptoms were gone. I was healthier than I had ever been, went down to chiropractic school in Atlanta, Georgia. And so that's why we have Revive Chiropractic right here in Lewis Center, Ohio. And so, that's the big question, or the theme of today is, health is something that we restore by removing interference and allowing the body to heal the way it was designed to. Your body, God does not create junk. If you're a believer out there, you understand that you were beautifully and wonderfully created in God's image. And so I think it's really interesting that people just automatically believe that, hey, I woke up with cancer. I woke up with heart disease. I woke up with diabetes. My headaches are here because my body just failed me. I've got autoimmune disease because my body is just breaking down. No, it's because there's interference. And then when there's interference to any system, there's going to be symptoms, there's going to be problems. In our traditional medical, what I would call a sick care system, you go to a doctor and you talk about your symptoms. It could be neck pain, it could be back pain, it could be headaches, it could be autoimmune disease, it could be depression, it could be cancer. And 9 times out of 10, you're going to walk out of there with some type of a prescription. And the goal is to help you by managing your symptoms. You never go to a doctor, a traditional doctor, and expect to get the root cause as to why you're sick. Actually, ask them that question. Hey, what is the root cause as to why I have heart disease? We don't really know. I mean, it runs in your family. And so, we're going to put you on these medications just to potentially prevent you from having a heart attack. From a chiropractic mindset, it's like, well, wait a minute here. Like, where's the interference in this beautifully designed system? Do you have inflammation? Is your diet full of sugar and complex carbohydrates? Are you not exercising? Are you not getting oxygen to your body? Why is your body creating more cholesterol? We ask the question as to why, because there's a purpose and a plan for every body. But if there's interference in that system, it's going to create dis-ease. And if that's not managed properly, then that's where bad things happening. So as I begin to kind of go into this here for section 1, the question that I have for all of us, and I think the greatest question that we could ever ask when it comes to determining who I'm going to trust with my health is this: why is the most medicated generation in history also the sickest, most anxious, and most broken? I think that's a question that we have to ask ourselves. Why is the most medicated generation in history, this generation now, also the sickest, the most anxious, and the most broken? Not only physically broken, but also financially broken because of medical issues. The definition of insanity is doing the same thing over and over again, but yet expecting a different result. And I say that because I'm not anti-medicine. I'm not anti-medical doctor. Medical doctors have saved my life, and there's times in my life where I've needed medicine in emergency situations. However, we live in a culture that says I get sick, I go to a doctor, I get a medication, I'm supposed to be healed. That's not the answer, and that's not going to get the root cause of the problem. Actually, what happens is the more medication that we're on, the more anxious we become, the more sick we become, the more broken, because we're not asking the question, why is my body sick, and what is the root cause, and where's that interference coming from? We live in a healthcare system that manages symptoms and not health. I love to use what I call the function chart. I tell patients, whether they're, just new in the practice and, 4, 5, 6 years old, or 60, 70, 80 years old, it's all the same. God does not create junk. Like, we're all beautifully and wonderfully created. And so 100% function is where our goal should be. Like, nobody wants to function at 70%. Nobody says, hey, I wake up one day, I'm okay functioning at 80%. If we had it our way and you could choose, everyone would say, I want to function as close to 100% as possible. 0% function is death. Research says almost every single orthopedic text that I've ever read says that at 40% damage. So at 60% dysfunction, after 40% damage to your body, is when your body will actually begin to elicit a symptom. So think back to when you had blood pressure issues, or when you got your first migraine, or when your back started hurting. Actually, the cause of that problem happened way before then. You just so happened to hit that 40% mark, and then you begin to have symptoms. When you have symptoms, like I said before, you go to a doctor. Most likely it's in network with whatever insurance that you have. You go there and you present them your case history. Well, you're having blood pressure issues. You're having migraines. Your back hurts. You're never going to walk out of there most likely without something to treat your symptoms. Now, my question to you is that if all I do is keep treating the symptom, and covering up that issue by taking a medication, a shot, or even having a surgery, but I don't find the root cause as to why that symptom actually existed, am I going to go closer to 100% function or closer to 0%, which is disease and early death? The answer is, if I continue to cover up the root cause of the problem by masking it with drugs, pills, and surgery, and I don't find the root cause, I'm always going to go towards 0. And this is where it gets really scary, because I'm on 5, 10, 11. I've seen 20 to 30 different medications, and I may be numb and I can't feel anything, but it doesn't mean I'm healthy. Being on medication doesn't mean you're healthy. It just means that your symptoms are being managed. And I don't know anybody who says, hey, I just can't wait to be on these medications. Everybody would say, if I could find the root cause of my health problems and I can have a proactive blueprint to chase after health, everybody would love that. More drugs, more surgery, more diagnosis, but less healing. You cannot be healed with a drug, a pill, or a surgery. The only thing that can heal your body is by taking care of the nervous system, feeding your body good food, getting proper sleep, prayer, fasting, different things like that. They're going to put your body in a state of healing. Medications will never do that. What if your body doesn't need more chemicals? Did you ever ask yourself that? Like, does your body need more chemicals, or does it just need less interference? You think of this with, neck pain or back pain, right? If you're sitting in front of your computer all day, you're looking down on a screen and your neck hurts, right? Taking a medication isn't going to fix the problem. It's only going to manage it. And then you're going to be doing more of that problem more often. The root cause would say, hey, lift your computer up, right? Start working on your posture. Go to a chiropractor. Start changing the structure of your spine so that way you can do what you love to do effectively without being on medication. Now what I want to do is I want to kind of transition into like what chiropractic is. So when you think of our traditional medical system and people taking medications and drugs, I just want to read some statistics to you before we kind of transition into like what is chiropractic? Like, because I get a lot of people that get very confused about, hey, what is chiropractic? I think there's a lot of chiropractors out there, and the Achilles heel of our profession is that we all do something very differently, which can be confusing. At least you go to a medical doctor and they all think the same way. You're going to come out of there with some type of a diagnosis, a medication of some sort. At a chiropractic clinic, you could walk in, some may adjust you, some may not, some may give you supplements, some may not. Some may say, hey, I'm not going to teach you how to eat or exercise at all. And some will say, hey, let's do all of that. So we're going to talk about what chiropractic really is. But I want to kind of lay the foundation for you of like why this is so important and why chiropractic needs to be the basis of how we think. Not so much for a chiropractic standpoint, but just the principle of chiropractic, in that the body needs no help, just no interference. And it just so happens that chiropractic is the greatest profession to remove interference from the nervous system and give your body, your family, your life what it needs to sustain health. This is in 2024. Just pulled this up the other day, just kind of looking at, hey, what is the current state of health right now? In 2024, this was on the CDC's website when they looked at all the richest industrialized countries in the world. You know, where does the U.S. rank when it comes to just overall health and wellness? And I say this because if you're trusting your doctor in our traditional American medical system as like your authority when it comes to health, like I don't know about you, but I like to look at numbers. Like I like to look at research. When I hire somebody to come into my home and to do work on my home, like I want to make sure that the person that's building my house is actually good at building houses. Like I want to make sure that the person who's, editing and recording the podcast that I'm doing right now is actually good at what they're doing. Like I can see their work. And so if I see their work and their work's not good, I'm probably not going to hire that person to do work for me. Right? My kids are wrestlers, right? And if I want private coaching for my kids, I want to make sure that the person who's coaching my children is actually good at what they're doing, right? And I say all this because if you look at the numbers in our traditional healthcare system in the U.S., we're not very good. And so if I'm going to hire somebody to take care of my health, they better be able to back up the claims that they're making. And the U.S. healthcare system is not really able to do that. So this is in 2024, the richest industrialized countries. The United States of America is the worst off of any industrialized country when it comes to overall life expectancy. The U.S., we don't live as long as any other country, which goes to tell me that our longevity, our overall state of health, and how we're managing our health is very poor. We just don't live as long as other countries. Number two, infant mortality. This kind of blew me away. Our infants die more in our country than any other industrialized country in the world. That's crazy to me. Like we have the hospitals and all the birthing centers and all the doctors and all these different types of things that we have. Like children die more in the United States than any other country in the industrialized world. Number two, safety during childbirth. Like I was telling somebody this the other day, an American hospital is the last place that you want to actually have a child. And people look at us weird, my wife and I, we had all of our babies at home. And I always get this kind of like weird look of like, why would you want to have your babies at home? Well, my question would be, is that why would you want to have your baby in a hospital, in a system that has the highest amount of infant mortality, and it's the greatest safety risk of any other country to having a child? The other one, unmanaged diabetes. Like we have a huge blood sugar, food, diabetes problem in this country. And we're spending all this money on diabetes research and all these different things, which all leads back to more medications and GLP-1 drugs, really to manipulate your body into believing that your blood sugar is not high, only for you to still make bad choices. We're not moving the needle when it comes to changing diabetes. Heart attack mortality. The American Heart Association has more money than a lot of associations. And where is that money going? It's going to more drugs, more dietary plans to fit the government, which is basically the food guide pyramid, more carbs, more sugar, more dairy, stay away from meat. The quality of your food doesn't matter. An aspirin a day keeps the doctor away, kind of a concept, and it's not working. We have the highest risk of heart attack mortality. And then unmanaged asthma. Like more kids have asthma in the United States of America that just is rampant than any other culture in the world. Like you can go to Dubai right now, which has like the air quality of like a sewer system, and it has less asthma than the United States of America. And so it's not the air quality. I would argue that it's our food quality. It's the amount of vaccinations that a child would get from the time that they're born to the time they're 18, which is pushing 80 vaccinations. In 1984, that was 6. Right? We got to start thinking about, like, what is the goal of our American medical system? Is it to keep us sick? Is it to actually, prolong health by giving more medications so we can manage systems? I mean, the goal of a hospital is not to take you out of the system, is actually to keep you in the system, because here's the reality. The more healthy people that we have, the less medication that we need, the less pharmaceutical companies make, and the less hospitals that we need. But the reality is until we change our mindset to where our health, my health, is my responsibility, the food that I'm putting in my body, the choice that I have to make to get up and move my body and exercise, to pray and to steward over my spiritual health, my mental health, my family. And then what we're going to talk about here in a second is just the one system in your body that controls all the other systems. This is not a belief system. Like chiropractic, people say, "Oh, you're a chiropractor." Like, I don't know if I believe in chiropractic. And the first thing I come back and say is that chiropractic isn't a belief system, because what is the one system that controls all the health and wellness in your body? What tells your heart to beat, your lungs to breathe, your digestive system to work, for you to digest your food that you're eating? What is the system that controls that? And the answer is not your heart. It's not your gut. It's not your liver. It's not just your brain itself. It's your brain and your spinal cord, which are your central nervous system. And so your brain and your spinal cord just happen to control every cell, tissue, and organ in your body. It's kind of like the information superhighway. And that's where chiropractic is magical. And that's where I want to transition into this next segment, which is, what is chiropractic really? And then what is it not? Number one, chiropractic is not just about back cracking. I know I was, my son plays, football and wrestle. It's always interesting, whenever I'm on the sidelines or I'm helping coach and someone says, "Oh, you're the chiropractor." And people start to just ask me questions. And I remember one time, one of my son's, kids on his team, his dad's like, "Yeah, I crack my kid's back every night before he goes to bed. It makes him feel better." And I always kind of get this like cringe, because it's like, it's not, you can't teach a monkey to crack a back. I mean, there's a difference between, lifting somebody up and cracking their back, and then like a very specific chiropractic adjustment done with the intent to restore the spine back to proper function and neurology. Like, anybody can just jump up and down and twist and crack their back, but that's not chiropractic. That's what we call manipulation. An adjustment is very different than just cracking your back. There's a lot of really cool things that happen when it's done specifically. The other thing that I would tell you is not just about pain. Most people go to a chiropractor because they say, "Hey, I'm in pain." I would tell you that probably 50% of my clinic come in every single week or every 2 weeks, and they're not in pain at all. And I would actually say that those are the most, the patients that I love the most. And I would actually say the ones that actually get it and understand health the most. Because you didn't wake up this morning and said, "Hey, man, my back hurts today, so I'm going to go work out in the gym. Hey, I ate sugar today, and I had a horrible diet over Thanksgiving, so I'm going to brush my teeth extra today." You're going to brush your teeth in the morning. You're going to brush your teeth at night because it's good to brush your teeth, because if you don't brush your teeth, you're going to get cavities. Somebody who goes to a chiropractor on a regular basis who does not have pain, that's not weird. That's just smart, because the nervous system controls everything. And so if you want your nervous system to function at maximum capacity, and you want your brain to communicate down your spinal cord, out the nerves to your heart, your lungs, your digestive system, if you want your reaction time, your sleep, your stress hormones, and just overall function to be as close to 100% as possible, a chiropractic adjustment and just regular chiropractic care is super important. I get this all the time. I come in, my back hurts. All of a sudden, my back doesn't hurt again. And then the patient actually stops coming in, only for them 6 months later to come back and be like, "Hey, Dr. B, my back hurts again." And I said, Are you ready to correct the problem and then maintain the health and well-being of your spine for a lifetime? I get it now. Another example that I would give you about this is kind of like braces. We're very much like an orthodontist. You go to an orthodontist and you get braces put on your teeth, and those teeth are corrected. The ligaments are stabilized. And then after 6 months to even 3 years, depending upon the teeth, your teeth look great. And then what has to happen for you to keep those teeth in the right spot. You have to wear a retainer. And if you don't wear your retainer, what happens to your teeth? Your teeth go right back to where they were, and then you have to spend a lot of money on Invisalign or new braces to keep it there. Chiropractic is very similar. You go to a chiropractor, you get your spine adjusted, you feel better, great. But the moment that you stop that process, chiropractic's no different than your teeth or going to the gym and working out. You work out, you're working out for the whole month of January. You're in the gym every single morning, working out, eating good food. You lose 25 pounds. You put on 10 pounds of muscle. And you're like, hey, I think I'm going to take 6 months off. Try that and tell me exactly what happens. Everything that you just did is going to go right back to where it was. Your marriage, right? If you don't keep working on your marriage and if you don't keep communicating and learning how to communicate and learning to understand the person that you love, bad things happen. So chiropractic is no different. We're not anti-medical. Like, I'm not saying that, hey, chiropractic is the only thing you need to do. All we're saying is that it's about pro-function. It's about pro-healing. Nobody I've ever talked to has ever said, I don't want my body to function at maximum capacity, and I'm just enjoying being on medications. Nobody wants that. But you have to understand what chiropractic is. And here's in a nutshell, here's what it is. A healthcare discipline focused on the spine and the nervous system. Why? Because the spine just so happens to protect your nervous system. You know, I tell people all the time we're nervous system doctors. And a lot of times they'll look at me funny and they'll say, well, my neurologist is actually a nervous system doctor. And I would argue, and I would say that your neurologist is an expert in neurology only to give you medications to manipulate your neurology, right? I've never been to a neurologist who didn't say, hey, your nerve is pinched going down your arm, you know, causing you to have tingly fingers or a tingly foot. So let's give you a shot to numb that. I've never been to a neurologist in the medical community who said, hey, what about the structure that actually protects the spinal cord where those nerves are coming out? And so I want to be very clear. A neurologist helped me. I mean, I had a plate in my neck, and I didn't really know chiropractic at that point, so maybe it would have helped me. But the reality is that awesome profession, good stuff. But even neurologists are really just there to manipulate and kind of minimize the symptoms. Real neurology is actually going back to the source, and the spine is what protects your nervous system. You've got, you know, bones from your neck to your mid-back to your low back that are positioned in such a way that protect the spinal cord and the nerves exiting. Any kind of shift or what we call a subluxation or out of position of those bones can create pain or not, but decrease the function that the spinal cord of the brain sends to the rest of the body. So for your heart, your lungs, your digestive system, your sinuses, your ears, like, we're not wireless individuals. Like, we're wired. And so if I cut the nerve that goes to your heart's going to stop. But if I pinch the nerve that goes to your heart's not going to work well. So for instance, if I'm sitting at a desk all day in a hunched over position and you see that person who's got that big hump on the back of their neck, those nerves feed right into the heart. I can almost guarantee you that 95% of those individuals have something going on with their heart that they're not even realizing has something to do with their nervous system. I get this in the clinic quite a bit. Individuals, especially little kids that don't go to the bathroom. Like, they're just not going to the bathroom well. They're learning how to walk. And when you learn how to walk, what are you doing? You're learning how to walk, and then you fall right on your butt. You're learning how to walk, and then you fall right on your butt. And when you fall on your butt as a baby, what do you think that does to those bones down there and those nerves that feed into the digestive system and the sphincter that allows to relax so the baby can go poop? Well, those nerves get irritated. So that's why they call us the poop doctor. Parents bring their babies in who aren't pooping. We adjust them. We change some things with their diet, and guess what? They're able to poop. I didn't heal them, but I'm just removing the interference from the system, and their body is able to regulate that system naturally. The same thing with the ears. There are nerves that go to your ears that control the membrane. Little kids that have irritation to the upper part of their neck, those nerves don't actually send signals to the tympanic membrane. They get fluid buildup. That's called an ear infection. You go to a primary care, you get an antibiotic. That's not going to remove the interference from that ear. As a chiropractor, we remove the interference with a specific adjustment, and the body begins to naturally begin to rid that fluid. And we have a lot of success with stuff like that. So removing interference so the body can heal itself. Let me be clear. And this is just what chiropractic is. Your chiropractor, Your doctor is not your healer. Like, I am not your healer. We are interference removers. God, the wisdom within your body, the Holy Spirit, the thing that God put there, the wisdom there, that if I were to cut my finger, in a week from now, there would be a scab there. Like, I didn't tell it to do that. That's just a wisdom of the body, right? They actually say that every 3 to 5 years, you have a completely new body because your cells and your tissue are constantly regenerating. Like, I don't tell my body to do that. There's just a wisdom within the body. That same wisdom is able to heal diabetes. That same wisdom is able to heal an ear infection as long as there's no interference there. Now, I can't tell you that if you're living off of Chick-fil-A and you're not exercising every single day, you're not getting good sleep, that having a chiropractic adjustment is going to cure your diabetes. But if you do the things necessary with the 5 essentials that we teach in our office, then we have a recipe for success. Chiropractic doesn't add anything to the body. It removes what's blocking it. Chiropractic doesn't add anything to your body. It just removes what's blocking it. I think this is the big difference between our traditional, what I would call sick care system, and the chiropractic health and wellness system, is that chiropractic doesn't add anything. It just removes any kind of interference or toxicity that could get in the way of your body's own natural ability to heal. And to me, that's like super cool. Super cool because I think it aligns greatest with God's design. Like, you know, we're not supposed to live off of all these different types of outside-in things. We're supposed to believe and trust to the power of the body, and chiropractic is just there to remove any interference that might be blocking it. I'm going to go into, some examples of the problem, like with our current healthcare system, and how chiropractic can really begin to kind of fill the gap with this. I think the biggest myth that we see here is that drugs and surgery save lives in trauma and emergencies. Actually, that's a true statement. In no way, shape, or form am I saying that, hey, we shouldn't have a medical doctor. You know, my wife and I have a primary care, a pediatrician in our back pocket, just in case there's something that my kids, you know, they just have going on that we just, it's scary to us. I mean, very rarely does that ever happen, but, you know, we've got somebody who's like-minded that, you know, thinks like us. And if my kid has a fever, it's not like, hey, let's rush and kill that thing. You know, we're not going to be forced to bombard our kids with a bunch of shots and different things like that if we don't choose to. But I want to make sure that we're clear is that there is a place, you know, for drugs and surgery and for, you know, our traditional sick care system. You know, that person who got in a really bad accident and they had to have limbs sewed on and, you know, and things bolted back together. And I mean, that's an amazing profession. But I think that we've gotten things a little bit twisted, that same profession can bring health to our body. Like that it's actually going to help us with our diabetes, our heart disease, our cancer, our mindset, our depression, our anxiety. That same system is going to help us bring health to our body through a chemical. Never, ever can I take a chemical from the outside in and actually bring health to our body. Now, it can help alleviate symptoms and in some instances even save a life, right? If I'm having a massive heart attack and I need to get an EpiPen or I need to get something to, you know, help with my blood sugar, that will save a life. But we have to start thinking about what can I be doing to steward over the temple that God has given me? How can I be proactive in what I'm living? If somebody's not proactive in the way they live, they're eating horrible food, they're not getting good sleep, they're not exercising, they have horrible posture, and they're complaining about having health issues, we have to take a step back for a second and realize that we might actually be the problem. Acute care doesn't actually equal long-term health care, right? Just because I feel good and I have no symptoms doesn't necessarily mean that I'm, you know, set for life, right? This is where this is going to be proactive, and chiropractic can help us do that. So I love this this concept, and this is something that I want us to think about for a second, that health is built daily through choices, not just swallowed in a pill. You know, I think, you know, we're living in a world of fast pace. I want quick fixes. I got things to do. I'm busy. But this is where I feel like, you know, the chiropractic profession and the sick care system really separate themselves. Health is built daily through choices. You know, as a chiropractor, you know, I say this to our patients on a regular basis, and I'll say this to you, is that your health is not my responsibility. And I think a lot of people will go to a medical doctor or somebody in the medical community and automatically show up and think that their health, like they're in charge of your health. I actually make this pretty clear in our office that your health is not my responsibility. Now, my responsibility is to do our job and to remove as much interference as possible. But then it's your job to help do your work at home, do the things that we need to do with food, exercise, nutrition, detoxification, to make your appointments. Like there's a choice there. Chiropractic is 100% with you, not for you. Like this is a journey together. And I think this is where, I say this also to patients, that where medicine is kind of sexy, right? I don't have to do a lot of work. I can just take this pill. I got this surgery. I got this cut out. I really don't have to think about it a whole lot. A gallbladder's like that. I had a conversation with a patient the other day that was contemplating getting their gallbladder taken out because my digestive system's all messed up and I can't break down fat. And I was like, well, let's think about this here for a second. Like, did God put a gallbladder in there for a reason? And they said, well, yes. I was like, well, why would you just want to automatically get it cut out? Like, we have to find out why that organ's not working. And you're going to have to start to make some better health choices. If you don't start making better health choices, then you're not going to have any choice but to get that taken out. Otherwise, there can be serious consequences. So health is built daily through choices, not swallowed in a pill. If you want long-term health results, you've got to make better health choices. I think where we get caught up is that the pill, the shot, the quick fix surgery, it's easy. I'm desperate. I'm in a lot of pain. I can't tell you that the natural part of just chiropractic and just health isn't hard. I'll be honest with you. I'm 42 years old. I'm a pretty fit guy, but people just automatically think that that's easy. That you just all of a sudden, all I got to think about is my fat melting off, and it'll just melt off. Like that's not the case. Like it's a daily up. It's in the gym. It's making good health choices. It's saying no to, not working out. It's saying no to fast food and sugar and excess things. Like it's a daily choice to want to be healthy. It's also a choice to want to not be healthy, right? And so you get to choose that. I just think that the chiropractic profession and what we do in our office, we give you a blueprint and we kind of walk alongside you hand in hand in this journey. But I get it, the medical, the shots, the pills, like it's an easy, quick fix thing. There's not a whole lot of work involved. It's the Monday through Sunday kind of pill jar. Hey, just take this and your blood pressure is never going to go up. My question is your heart really healthy because of that? Is your mind really healthy because you're on the anxiety medications, or are you just chemically altering what's going on in there? And I would even ask you, what are the long-term side effects of continuing to cover up health problems that you're not willing to take responsibility for? There's huge things in that. The body is designed with intelligence. Health is not random, it's purposeful. Stewardship of the body matters. I love 1 Corinthians. I was thinking about this the other day. This is 1 Corinthians 3:16 through 17. Do you not know that you are God's temple, that God's Spirit dwells in you? If anybody destroys God's temple, God will destroy him. For God's temple is holy. I are that temple. I know not everybody that listens to this is a Christian, but if you are, or if you're not, I just want you to understand that your body is not yours. I think sometimes we wake up in the morning and we make health choices because we just don't look at the end game in mind. If you're a Christian and you understand the Great Commission is to go and to make disciples. And to go means that you actually got to get off your butt and you've got to go. It might mean that you actually have to go long distances. You may have to go to other countries. You may actually have to travel to speak and to even, sacrifice your own body and go through something really hard in order to be able to reach somebody for the gospel. And so the greatest heartbreak for me is seeing somebody who is a believer desecrate the temple of God, but yet complain of where they're at, right? We have to understand that our bodies are not our bodies. I mean, I use the example of like loaning a car or like leasing a car. I've never leased a car. I don't really know what that's like. I always try to buy the car, but it's like, hey, when you lease a brand new Lexus and you have it for a year, you're not allowed to take that Lexus a year later to the car dealership destroyed with, French fries all over the place and puke in the back seat and mud everywhere and the seats ripped up. Because if you do that, then you're actually going to get in a huge financial problem because of that. And I feel like the body is very similar, right? Like our body is on loan. Like our bodies are not really our bodies. Yes, we do have a choice, At the same time, the choices that we make have to be congruent with living in such a way that allows us to be healthy, vibrant, clear minds, clear hearts, healthy bodies, so we can go and we can make an impact. Whether or not you're, an owner of a company, or if you're a school bus driver, right? I mean, it's super important for us to be super healthy and super focused, because in those particular instances, like, we're in charge of other people. We're in charge of other people's well-being. And so we have to be sharp. We have to be healthy. I think one of the scariest things to think about is that, the over-medicated, the over-toxic population that we have in individuals that are leading other people, and how that can affect the leadership and just the overall longevity and health and well-being of the people that they're leading. And so health is built on daily choices, not a swallowed pill. Make good choices. Next section. Who is chiropractic for? I think that this is, an awesome question. I get this quite a bit. Like, well, who's chiropractic for? And different fields of thought will tell you very different things. I have never had more patients tell me that their medical doctor said, don't go back to your chiropractor, than ever before. Over the last 2 or 3 years, I don't know what it is. It may have something to do with the fact that what RFK is doing and some of the things being cracked down, the medical profession is really trying to be super strenuous on like who they are and what they're doing. But I have never had more patients come back to me and say, hey, my medical doctor told me never to come back to you. First and foremost, I would never tell somebody not to go to their medical doctor, because that is your choice. And I honestly think that we need to be a team. That like there are things that I just can't do, that I don't really want to do. Like, I don't want to prescribe medication. I don't want to really learn about medication. I don't want to tape ankles, and I don't want to put braces on people's knees. Like, I just don't want to do that. I want to adjust people's spine and nervous system. I want to educate about nutrition and health and well-being and spiritual stewardship over their life. Like that, those are the things that I love to do, and we're some of the best in the world at. When it comes to emergency medication and like doing surgeries and things like that, like that's just not what I was called to do. We have some of the best in the world to do that. We have to work together. But chiropractic, in my opinion, and just makes sense to me, is for everybody. Chiropractic is for newborn babies that are looking to just get a really great start into the world. I say that because all of my sons were born at home. All my sons were born at home. My wife is an amazing woman. Birthed all of our kids at home naturally with no medication. I mean, I literally caught every single one of my sons. Like, just like minutes after they were born, I checked them for neurological interference. It's a rough process. It's a beautiful process, but it's also kind of a rough process for a baby to be born. All the squeezing of the cranial bones and everything has to be, kind of perfect for there not to be any kind of issues there. But even then, it's just good to make sure that the baby is checked and free of interference, because what's a more beautiful thing than a baby coming into this world free of interference, toxin free, so they can begin to develop neurologically without any interference. Like, I don't know a more beautiful thing in the world versus I'm yanked out of the birth canal with like cold forceps, or I'm cut and I'm pulled out of the birth canal via a C-section, and I'm being yanked on and tugged on. And then the first thing we do is that we squirt erythromycin in the eyes, and we put all these different things from the outside into you. It's a very interesting thing. And so regardless if you're having a natural birth or you're having a hospital birth, no judgment there. Every single baby and child should be checked for neurological interference. And then young kids. I mean, I've got 4 kids in my house. It's like a WWE wrestling match in my house. Like 4 boys. There are holes in our walls. They're always hitting each other. We have a trampoline. They wrestle. They play football. I mean, kids' spines are still cartilage. They're not even hard bone yet. So think about that time that maybe your kid fell off a swing at like 4 years old, or that time that maybe you fell when you were a kid and like you got your teeth knocked out. That can shift, and that can create massive amounts of neurological interference, which can do things like cause seizures. I've got a little boy in my office now who's not little anymore. He's actually 17. But this boy came in with seizures. I actually spoke at a church, and his mom came in after I spoke at this church, and the pastor's a great friend of mine and a patient. And this Jetty came into the office, and he's 17 years old. He's kind of on the spectrum, and he's had seizures ever since he's been little. And the question that I asked his mom is like, was there any point in time when Jetty had a big fall or something like that? And she goes, you know what? Whenever he was really young, like he fell off the high chair and he hit his head. And really ever since then, it's like that's kind of when things started. And I said, well, what was the kind of protocol for him? Well, we went to every neurologist. We've got brain scans and MRIs and all these different types of things, and nobody can tell us anything about any blood or anything that's wrong with his brain. So they did an exploratory brain surgery, and they put all these things on him. And then but nobody ever said anything about his spine and his brainstem and his nervous system. He's been on medication since he's been like 4 years old, and he still has seizures. I think he wants to be a normal kid. He wants to go to school. He wants to go to college. And so he comes into our office, and I take an x-ray of his spine, and he has lost every single bit of that natural curvature that you're supposed to have in your neck. And his head is literally 6 feet in front of his body. And he's got so much pressure on the upper part of his neck that he can barely move his neck. But not one neurologist has ever said, hey, maybe you should go to a chiropractor and get your spine adjusted to remove the interference. Jetty has been a patient in our office for just 2 months. He's completely seizure-free. Like, he has not had a seizure in 2 months. His mom's like crying, like he even comes to me the other day. He's like, Dr. B, I focus better than I ever have before. Like, I think I want to like work on trying to go to college. Like, those are big things, right? And so chiropractic is for everybody. Athletes. I was a Division I athlete. I've been an athlete since I've been little. If you've got kids and they're football players, they're wrestlers, they're basketball players, they're even runners or whatever, soccer players, they fall, they get banged up. I'm not anti the athletic training room, but the athletic training room is for when they already have an injury. That's already too late. Your kid, if they're an athlete, should be managed and maintained and just have regular preventative care to prevent them from having to go to the athletic training room. Like I said, I spent my entire athletic career getting ice and stem and heat on my shoulder, ibuprofen, my ankles and my knees wrapped up. I'm not saying that's bad. I'm just saying that if athletes were maintained at a chiropractor, regularly adjusted, their nervous systems were maintained, they ate well, they got good sleep, they took good supplements, we would not see near the amount of injuries that we see currently, because guess what? Don't wait until your athlete has an injury. It's something that we do regularly. And you look at some of the professional athletes. Look at professional runners. Look at professional football players. Look at professional hockey players. Like, they have somebody regularly taking care of them because they don't want to have injury. If you have a young kid, that's where it's at. Pregnant moms. We specialize in pregnancy and maternal care. If you're a pregnant mom out there and you're thinking about having a baby, it is hands down, births always go better when mommies are under chiropractic care. Why? Because you've got this big watermelon in your belly. You've got all these different types of ligaments and everything that are changing. Your pelvis, if you've had back issues early and you've had back pain, or if you've got, you have things like a scoliosis, or you've got some pelvic issues, it's really, really good to make sure that you get that stuff fixed before you have a child. Because what happens is, if I go to put a watermelon in there and I've already got restriction in certain areas, oftentimes the pelvis doesn't want to open up. And if the pelvis doesn't open up, then that's where babies want to go butt down. And that's what we call a breech position. And this is where C-sections happen. So in our office, we actually are certified in what we call Webster's technique. So we can actually adjust the body, remove interference, so the body can naturally want to have that baby go head down. It's just a beautiful process, and it's hands down. Mommies are like, hey, I've had 3 or 4 kids. I just started getting chiropractic care. This birth was way easier than all the other ones, plus my recovery time was much better. And if there's no interference in the mommy, guess what? There's less interference on the baby. If mommy's not stressed because her body's healing and functioning better, then she's not taking away awesome nutrients for the child. Anyone wanting long-term health, So we've talked about kids, we've talked about adults, we've talked about athletes, we've talked about moms, we've talked about babies. I would just say the last thing that I'll say here is that chiropractic is for anybody who just wants long-term health. If you want the short-term quick fix, like I just want to get out of pain really quickly and I could care less whether or not I'm on medications or I get a surgery, chiropractic's not for you. At least not in my office, right? There are offices out there that's like, hey, come in, $25, get your back popped, whatever. I'm just saying that in our clinic, if you're somebody that values health, you don't know what it is yet. Like you just know that you can no longer be on medications and drugs and surgery, and like no longer can you think about them cutting another organ out. Like we can help you. But I think it's just for anybody who's just, listen, it doesn't make sense to me to take a medication to treat a symptom. Like I want long-term health. Like I think about this as a dad. I've got 4 boys, and what drives me, to get up and work out and choose the apple over the donut or the grass-fed steak over the Chick-fil-A sandwich. Like why? It's not because I like to, see myself at the beach jacked, even though it's cool for my kids to have a dad that's jacked versus the overweight dad who's not. But the point is that it's bigger than me. Like I don't want to just be healthy right now. I have to be healthy for when my grandkids are here, because if you're listening to this, you get this. Like grandma and grandpa, they can't come to things. They can't play with grandkids anymore because they're hooked up to an oxygen tank. They're in a wheelchair. They're on 15 different medications. They're eating out of a straw. They're drooling. They're in a nursing home. That doesn't have to be where we are. I would actually say that God did not create us for that. God created us for way more than that. And even biblically, I mean, we were living healthy and vibrant into our hundreds, and that is completely possible. But it does take work, it takes effort, and it also takes knowing what health is and understanding that health is a proactive thing. Health is not a reactive thing. So if you want long-term health, regular chiropractic care, regular exercise, regular good, healthy nutrition, quality supplementation, and a deep, intimate relationship with the Lord and knowing who it is that you serve, I think that's where, for me, I know who I serve, and I know that there will be consequences for the fact that I don't take care of my body. And so chiropractic is for everyone. It's not for people who are looking for quick fixes. I'll help you, but I'm also going to have to change your mindset. Because if you're in it for a quick fix, I would tell you that I would even say a lot of parts of your life aren't good. If you're in it for a quick fix, because just read the Bible for, any part of time, read Proverbs, slow and steady is the game. It's the long-term game in mind. Wealth gained hastily is not good, right? Health gained hastily is not good. So nothing quick fix really ever is really good. So we got to think of the long end game in mind. Those unwilling to take responsibility, we have to begin to take responsibility for our health. I think the reason why medicine has been such a huge crutch for a lot of people is because they take the responsibility. You come in with your cancer. We're the best in the world. We've got the drugs. We've got the technology. Hey, just let us cut this out. Let us burn this out. And then, hey, take this pill for the rest of your life to make sure it doesn't come back. I can't tell you how many stories I've had with patients who have come through our office with cancer. And I say this, what were you instructed to do after your cancer was gone? Nothing. Go live life. Go have fun. And I said, no nutrition advice was given. No lifestyle advice was given. No education on how to make sure that your body's healthy and vibrant was given. No responsibility was given. In our office, your health is your responsibility. My health is my responsibility. We have to take responsibility for the temple that God has given us. Those wanting somebody else to do the work, right? If you want somebody else to do the work, now we have to deliver the adjustment. Like, we're educated, we're smart. Like, I know health better than most people, which is why it's really good to, learn. At the same time, like, you have to be willing to put in the work, right? If I have an athlete that comes to me and says, hey, I want to be a state champion wrestler, but they're not willing to put in the work, good luck, right? Because talent only goes so far. Like, we've got to be able to put our head down and say, hey, I'm willing to take a step back, take responsibility, sacrifice some things, and be willing to put in the work. But here's what I'll tell you. When you do those things, when you take responsibility for your health, when you understand whom it is your body is and who it serves, and you are stop looking for quick fixes, this is where I believe we become the healthiest country in the world. We spend the most amount of money than any other country in the world on healthcare, and we're the sickest. Why is that? Because we're lazy. We think a pill is going to fix it, and we don't take responsibility. This whole MAHA movement with Robert Kennedy Jr., I think is great, but nothing will change until we take responsibility for the body that God has given us. Red dyes out of Fruit Loops and a vaccination schedule change, I think those are great things. Nothing changes until someone says, hey, I have to take responsibility. Hey, doc, I understand what you're saying. My blood pressure's high. But listen, before you give me that medication, I need to stop eating fast food. I need to start working out. I need to start doing these things regularly. I need to take some responsibility. And oh yeah, by the way, if I'm taking responsibility and I'm working really hard and it's in a dangerous level, then I'll think about it. That's whenever we would start to become a healthy culture. We also would start to become a healthy culture when we work together and say, hey, there are just people that are experts in certain things. We need to work together to be able to create a healthcare system that works for the people, not for the big companies and the big money and the big businesses and the big pharma. We need to start thinking about creating healthy families, healthy individuals, and that's only going to happen if we team together and say, hey, we are experts in these particular fields. Let's make sure that we put these people in the correct categories to make the best change. Just reinforce some things here as we close out. Your body was designed to heal. No question about it. Like, it doesn't matter if you have stage 4 cancer or if you're just, you fall down and you cut your knee. Your body was designed to heal. Doesn't matter how many medications you're on. Doesn't matter how many specialists you've seen. God has a plan and a purpose for your body. And people tell me this all the time. Dr. B, you give me false hope. I said, no, I'm just never going to tell somebody their body doesn't have an ability to heal. I've seen it. I've seen people come into our office with no hope, nothing, tried everything, and they kick it in gear. They take responsibility. They start making amazing changes. Their body can heal. Your nervous system is the master center. There is no system in your body that's more important than your nervous system. Think about it. Cut your spinal cord in half and let's see what happens. Lights out. You're not here anymore. Your nervous system controls and coordinates every single system in your body. So before you go to a cardiologist, before you go to a pulmonologist, before you go to an endocrinologist, before you go to a gastroenterologist, before you go to an oncologist, I'm not saying don't go to those, but you better go to a doctor that understands how to take care of the nervous system that controls all the organs at the end of the road. Because it just so might happen to be that your nervous system is not sending correct signals to the organs that are now diseased. And so we need to work together on that. Chiropractic restores function, not dependency. I don't want you to be dependent upon me. I want you to get better, get healthy, learn how to take care of yourself, and then use chiropractic as a preventative source for disease and dysfunction not to come back. Don't be dependent upon medication. Don't be dependent upon your doctor. Don't be dependent upon anybody besides God to restore health to your body. Your health is your responsibility. So here are my call to actions. Number 1, get your spine checked. The greatest thing that you could ever do, the greatest test known to mankind, is an x-ray of your spine, because a bad spine equals a bad nervous system, and a bad nervous system means bad health. I've never seen one person who's come in the office who's like, oh, I'm my spine hurts and I'm in a lot of pain. But hey, you know what? I don't need my spine check. I've never not seen an x-ray that didn't correlate to what was going on with them. I've also seen people who are like, hey, I'm fine. I feel great. I've got 6-pack abs. Like, I run 30 miles a day. Like, I eat sardines and avocados. I feel great. And then me take an x-ray of their spine and them not have subluxation. We live in a world where we're sitting, we're banging up our body. I have never seen the amount of stress load that we put on ourselves mentally, physically, spiritually, relationally. Subluxation can come from physical trauma, can come from chemical trauma, and it can come from an emotional trauma, thoughts, traumas, and toxins. All those things can change the spine, so get your spine checked. Educate yourself beyond pain. Educate yourself, right? Ask questions. Just because you're not in pain doesn't mean that you can't learn about how to take care of your body. Some of the scariest situations I've ever seen as individuals, especially dads, I'll call you guys out. You guys, men over the age of 50, I'm bulletproof. I don't need to do anything about it. I'm not in pain, so I don't need to take care of myself. And all of a sudden, boom, heart attack. All of a sudden, boom, cancer. All of a sudden, boom, dementia, Alzheimer's, all these things. You need to take care of yourself just as much as anybody else. So just because you're not in pain doesn't mean you don't need to be educated and taken care of. Choose function over pharmaceuticals. There's nothing functional about pharmaceuticals. Pharmaceuticals are a quick fix way to manipulate chemistry to make you feel better. And it's actually really cool. Like it's crazy what they can do, right? They can take somebody who's 400 pounds and has a problem with sugar, and they can give you a GLP-1 drug and it manipulate your body. And literally in 3 or 4 months, you'll lose 200 pounds. But the side effect of that is cancer. The side effect of that is sarcoidosis, which is muscle wasting. Your life expectancy goes down. All forms of chronic illness go up because of that drug. And so just because pharmaceuticals can do that doesn't mean it's the right choice. Choose function over pharma. Lead your family and steward real health. Lead your family toward real health. If you're a dad, if you're a leader in your family, start stepping up and making good decisions. You need to be the leader, and you need to be a doer, not just a hearer. So specifically with dads, like I got a soft heart in my place for dads. It's like your kids, your family are going to do whatever it is that you're doing. So if you're living off of pizza and beer, and you're sitting on the couch not doing anything, don't be surprised if your kids live off of pizza and pop. Hopefully not beer, right? But if you're leading your family in a good way, like if you're getting up and you're exercising, you're getting in God's word, you're regularly taking care of your nervous system because you find value in prevention over just quick fixes, you will find that your family is going to be probably one of the healthier families that you know, right? It's almost even weird to hang out with families who just don't steward over their body. My family is like that. It's like my kids go to school and it's like, well, we don't eat those things. Why not? Because it creates toxins in my bodies. It's an interesting conversation, but that all starts with leadership. And so we have to be doers, not just hearers. So that's going to wrap up today's show. Make sure you smash that subscribe button if you're listening via podcast. If you're a patient or if you're out there and you're sick and tired of being sick and tired and you want quality health, find a chiropractor. If you're in the Lewis Center, Columbus area, go to our website, revivechiro.com. That's revivechiro.com. You can make a new patient appointment online, or if you want to give us a call, 614-781-8808. I pray that you have a healthy, happy, blessed day. Bye-bye.